So we're gonna use the door jamb here to drive this overhead external rotation, and then we can get really creative about using our trunk and our lower legs to drive more rotation into external rotation where we're combining different planes of motion. So our shoulder and our hip are these big freely movable joints that we often will train in these isolated movement patterns when typically in a normal life or sporting events we train throughout different motions. So it just allows us to be able to kind of put the arm on an object, hold on to it, and then drive all these different motions. So simply what I can do is I can start on the wall here and like having my upper arm parallel to the floor and then having it just about straight out in front of me. So this setup here is going to be the least aggressive position for people. And what I can do is I like to kind of pick one point of motion at a time and address that. So then I can just kind of step, open my torso up, come back, and I can move through that plane of motion, right? So typically that motion is going to be horizontal abduction and then adduction returning back. Now, if you have a tight shoulder joint, you're gonna really wanna arch that low back. So you can be mindful of keeping your abs recruited and turned on so you're stable through your pelvis, rotate. Now I'm getting that stretch across the front of my chest and we're working on getting external rotation. Maybe this is a cocking position for throwing a ball. It's gonna look different for everybody, right? So then I could slide a little bit up the wall and I could go through the same type of setup where I'm working in that position, external rotation. And then we can start changing our trunk position front to back like I was just talking about. So if my arm's fixed and I kind of lean back, it's going to take me into internal rotation, so it's going to take less of a stretch. If my arm is fixed and I rotate into my chest forward, I'm going to rotate into external rotation, which is going to create more of a stretch across the front of the shoulder. So I could simply be getting into this position, and it could be like shifting my weight forward and bringing my chest toward the floor, shifting my weight backward, bringing my chest toward the ceiling. Now I'm transitioning in between these 2 points where I'm using my trunk to drive motion in that arm to go after some of those range of motion deficits. And there is no right or wrong if you've seen the internal rotation video. It's just being playful to where you feel like the most restriction. That's the spot that we're trying to hang out at, because we're trying to get your brain, your nervous system comfortable to being in those positions again and not have a painful response. So deep stretch is normal. Challenge the beliefs, the sensations that you're having, not the beliefs. Is what I mean by that is you get up there and you start to move, a lot of people are going to go ow immediately because they perceive that as pain. Is it pain or is it an abnormal stretch? Is it a sensation? Is it something that you're uncomfortable with, and do we need to spend a little bit more time in that position to make your brain more comfortable, which is then going to allow us to train in that position where that's where it's really going to create the lasting change, is training throughout those range of motions. So again, play with your setup, arm fixed, you can change your angle, we can use your trunk to drive rotation and motion, we can add head turns, those types of things, which we didn't do specifically, but would be like getting set up. If I'm super sensitive, I can get into that stretch position, and then I can kind of transition my neck and move through my neck as well, just due to the nature of where some of those muscles attach into your neck and down into your shoulder blade.